My name is Dr. Mark Rowley. I'm an orthopedic surgeon at LewisGale Medical Center. The initial symptoms that a patient comes to see us in the clinic is initially for shoulder pain and perhaps associated shoulder stiffness. Many times there's been an associated injury. The initial evaluation would involve examining the patient, looking for deficits in range of motion or strength. We typically would get an x-ray which would show us any fractures or arthritis associated with the condition. It's typical at that point, if the patient remains symptomatic after initial treatment, to proceed with an MRI imaging to look for rotator cuff tears or significant arthritis. By the time the patient has come to the operating room to have his or her shoulder replaced, they've gone through non-surgical management, which most patients get better with, and that would consist of physical therapy and medication. Many times those medications are either anti-inflammatory medications or corticosteroid injections in the shoulder. The first model shows the disease process of arthritis, where the cartilage and bone is worn down. So as the patient moves the shoulder, they have limited motion and it's very painful. The second part of the model shows the artificial shoulder replacement, where a stem is inserted down into the humeral shaft after the joint is removed, and then coupled to a plastic base plate in the scapula to form a nice smooth articulation which improves motion and relieves pain. This is typically a one-night hospital stay. The rehab period lasts 6 to 12 weeks, and the initial part is aimed at regaining motion in the shoulder, and the second 4 to 6 weeks is focused on regaining strength and function. Most patients are certainly able to do their activities of daily living and some recreational activities without pain. There are some limitations if they're heavy laborers or contact athletes. There may be some limitations with that. This is actually a x-ray of a patient we recently cared for with a new technique called a reverse shoulder arthroplasty. As opposed to the standard shoulder replacement, which requires an intact rotator cuff, this device is engineered where the ball and cup are reversed, and that's why it's referred to as a reverse shoulder. And it's allowed us to take care of many patients, primarily older patients, lower demand patients, that have a deficient or non-existent rotator cuff, and has really revolutionized the care of arthritic conditions in the shoulder. The reverse shoulder arthroplasty, which is shown in this radiograph, we anticipate to last the lifespan of the patient. It's a relatively new device, so the data has only been out approximately 5 years. The rehab is different than what we talked about for the standard shoulder replacement. Since the patient lacks an active, effective rotator cuff, we have to immobilize the shoulder for approximately 4 weeks before starting the rehab, as opposed to the standard shoulder replacement, which starts immediately. The ideal patient for this device, the reverse shoulder, would be a lower demand patient in their approximately 65 to 80 years old that has severe disabling shoulder pain, has not responded to non-operative management, injections, anti-inflammatories, and physical therapy, and has difficulty performing their activities of daily living.